Hi, my name is Rena and I'm the Training Development Officer at the West Australian AIDS Council. The AIDS Council is a community-based, not-for-profit organisation, and we provide a range of services to people in Western Australia, especially to people affected with HIV and AIDS. So we provide various training opportunities to health professionals, one of which is the bloodborne virus informed consent training, which we have been delivering for over a decade now. This is an invaluable 2-day professional development training which will equip you with the skills to conduct a pre- and post-test discussion. The aim of the bloodborne virus informed consent training is to increase competency and understanding of best practice principles for various health workers involved in pre- and post-test discussion. This training will empower health workers to engage and clarify clients' risk for bloodborne viruses, educate the client on testing practices, the window period and treatment options, gauge readiness for a positive diagnosis, facilitate coping and support mechanisms for a positive diagnosis, and support the client to commit to safer behaviours. I delivered this training with 2 counsellors from the AIDS Council. I now would like to introduce you to one of my co-facilitators, Ben.
Hi, my name's Ben and I'm a counsellor at the WA AIDS Council. I've been involved in giving pre- and post-test discussions and delivering the training to allied health professionals for the past 8 years. When I reflect on the experiences of clients who have received a positive BBV result, it is easy to identify why it's so important to do adequate pre- and post-test discussions. When a person's tested positive and they're uninformed about what the tests were and what the positive diagnosis means, they're usually in a state of shock, which means they're unable to accept and retain and process the information required to adequately deal with a positive diagnosis. The health professionals in such a situation face the unenviable task of trying to contain and support a person who is struggling to digest the information. In contrast, when a person has been fully informed about the tests they're going to have and are able to understand what a positive diagnosis would mean to them, as well as the risks that they are currently facing during their test, they're much more able to engage in the health and support services which will make their diagnosis that much easier to deal with. Therefore, for both the health professional and the clients undergoing pre- and post-test discussions and BBV diagnoses, I fully encourage people to attend the BBV training. The feedback from allied health professionals we've received who have attended the training has always been extremely positive. They feel more confident and more able to assist their clients, and they also feel more at ease with their own practice as they get a grasp of the best practice principles of delivering pre- and post-test discussions.
I know I cried and cried for days. I hid out. It still brings up emotions today because I didn't have any pre or post-test counselling. I was just told, yes, you're Hep C positive. No other information. The more information I read about, the scarier it got. Well, with pre and post-test counselling, pre-counselling, pre-test counselling, you'd be well informed of what all the outcomes can be and what the treatment options are. And post-test counselling, if you're so upset like I was, you've got a chance for someone to calm you down and sort of bring you into reality of what is going to happen next instead of wandering around in your own mixed up thoughts all the time.
Hi, my name's Liz and I'm HIV positive. I never received any pre or post-test counselling and as a result was shocked and unprepared for my diagnosis. The GP who diagnosed me was unable to give me much information about HIV and she wasn't able to assure me what my long-term health outcomes would be as a result of living with HIV. Instead, the GP informed me that they would no longer be able to help me and instead I would need to check myself into the infectious disease department at the hospital. My understanding of HIV was limited, but I was aware it was a serious medical condition and that I needed to link myself in with a specialist at the hospital who could help me. My first thoughts were, how long was I going to live for? When would I become sick? Would I be able to have a family? And would anybody love me? I think had I received any pre or post-test counselling, it would have been easier for me to understand living with a chronic manageable illness. As a result of not receiving any pre or post-test counselling, it did take me a significant time to accept my diagnosis. I think it was my resilience and independence that day that allowed me to follow up my care without needing the assistance of the clinician or GP. Perhaps others in my situation wouldn't have responded this way. Perhaps after their initial appointment, they might have never followed up with secondary care.
We encourage you to share our commitment in effective HIV and STI care. Our collective aim is to assist health professionals to enable their clients to embrace regular testing, early treatment, and a continuing commitment to safe behaviours. We invite you to attend our 2-day training, which we offer twice a year. For more details, contact us on 9482 0000 or visit our website at www.waaids.com. Hope to see you there.